We're like a Walmart greeter at the digital front door. So personal, all about human-to-human connection, but with leveraging technology underneath to make things scale. So we're bringing people in. We're meeting people where they are.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. Some startups provide tools directly to consumers and patients, while others tackle issues more in the hospital setting at the other end of the care journey. Our two guests today, Dr. Scott Kaiser from Determined Health and Nick Lockett from Pear Suite, they occupy a sort of middle ground. They empower communities and community-based organizations to provide better care for vulnerable people. It doesn't take much to see the need for more empowered communities in healthcare. Every day we see more headlines about an epidemic of loneliness and the role of social connection in health outcomes. That data is in, and it's not good. We know from our own experience that there are health concerns you might share with a friend before turning to a doctor. Nowhere is the need for community-based health intervention more clear than with seniors. According to our guests today, that process starts with empowering authentic, actionable communication. So they've built unique tools and platforms designed to make that process scalable, replicable, and easy. My first guest today is Scott Kaiser, CEO and co-founder of Determined Health. Kaiser, a trained geriatrician, along with his team, was recently recognized by Chime and Scale Health as a finalist in their Patient Engagement Challenge. After receiving the award in the Digital Front Door category, he likened his company to being the Walmart greeter for the healthcare system. Here he is to explain. Scott, thanks for joining me today.
Great to be here. Thank you.
So I saw you just yesterday receiving an award right here from Chime. Tell me what that was for.
Yeah. This has been great. Lots of momentum for us. That was Scale Health partnered with Chime on a patient engagement challenge.
Okay.
And we were a finalist in the Digital Front Door.
Okay.
Which is really cool.
It's a good segue into what Determined Health has built.
Yeah. So it's cool. It's got us thinking a lot about how we fit in that schema of the Digital Front Door. You know, we've built a connected community care solution that really focuses on addressing loneliness and other social determinants of health. And so this community care solution, it's all about curating networks of community partners, training a workforce of community callers, driving engagement to manage social determinants proactively. So, how does that all fit with the Digital Front Door?
Yeah.
And it's really cool. And we're getting this warm response from the health systems too. They're seeing it the way we're seeing it. We're like a Walmart greeter at the Digital Front Door.
Okay.
So personal, all about human-to-human connection, but with leveraging technology underneath to make things scale. So we're bringing people in. We're meeting people where they are, right? It's Walmart greeter. You could take the analogy a little further.
Yeah.
They kind of follow you around the store in a non-creepy way, and then...
they can help you with.
Yes. Yeah. Anything they can help you with.
Yeah.
So there's a lot of people, great to have a Digital Front Door, but you're going to leave a lot of people behind out in the cold.
Yeah.
So we're just bringing people in through human-to-human connection that's tech-enabled.
Okay. What's the patient experience if there's a community that they're in that's using your platform?
Yeah. So, imagine you're a patient who is cycling in and out of the ER. You got multiple chronic conditions. They're all out of control. You've got all sorts of crises. You're going to the ER multiple times, even a month.
Yeah.
And so, somebody notices, hey, something's really not working here.
Yeah.
We'd like to refer you into this program. Well, we try not to use the P word, but hey, we've got this new great service that might be a good fit for you. So then that name is given to us. We reach out to them. Our engagement rates are really good with our approach in reaching out to people. What we do is we offer pairing them up with somebody who's just been trained to be a good empathic listener.
Okay.
These people that they're paired with, they might be a paraprofessional, they might be a trained peer, a student, all sorts of people.
Someone in their community or someone at your organization centrally?
No, in their community.
Oh, cool.
And that broadly, that might be very local, or that might be another part of the state, or maybe even a further geography. But
not just one central call center.
Exactly. No,
Taking care of
exactly.
Got it. Okay.
Exactly. And those folks come through relationships with trusted community organizations. So you're not just getting a link to a person, you're getting a link to a whole community.
Who do you work with? Who's that person who refers? So who's kind of the spark of the relationship?
Yeah. I mean, it depends, right? It depends on our customer relationship. We have situations where we're used just as a pure SaaS platform, and all the internals and everything are all done kind of internally. But ideally, you think about somebody who, on a care management team, we do a great job of extending the power impact of nursing and social work care management.
Okay.
Right. So you imagine somebody, they have a lot of responsibilities. They're doing their health risk assessments. They're checking in on people for a variety of clinical things. They don't have the time to just chop it up, just get on the phone and just talk about, that crazy thing that happened last night at the game, whatever it is. And then that's what our folks do.
Sure.
Right. But at the same time, we give them the tools to be an early warning system at the same time. Sort of see something, say something. They don't need to do anything about it. They just flag the issue. Oh, person's really struggling with access to food. Boom, goes in our system, gets routed to the care management team, gets routed back to the Meals on Wheels program so that you can connect the person with a home delivered meal. And that could be the thing that keeps them out of the ER.
Interesting. So if I'm one of your community health workers who's been trained on the system, I've been trained to be a great active listener.
Yeah.
Am I reading through a script? What kinds of questions am I asking?
Right. Yeah. No, definitely no script.
No script. Okay.
No script. They are trained to engage a person in conversation and to be a good listener. And a lot of good listening, is active listening and following. You might be with somebody who really likes to talk a lot.
Yeah.
You might be with somebody who really is a little more reserved and likes to listen. Understanding that to make the right match is part of what we do. But then for our training, for our callers, understanding how to adapt to the situation to be the best listener they can be, the best support in that situation. And their job is just to connect.
Okay.
That's their job.
And they're on some sort of determined health CRM style platform where they can say, John Smith has this concern. That's where they can red flag things for future.
Yeah, what's even better is they don't even need to log into the platform either.
Really?
So they'll just get a text message, for example, after the call to say, with a checklist of things, that were there any issues around social isolation, transportation, food access, financial, healthcare follow-up, and, a notes section on, just like anything you'd like to share about the conversation today, anything we should know.
And that data goes where?
So that data comes back to our platform where whoever the organizational administrators, have that. In the case that we were just describing, that would get routed back to the care management team.
Okay.
So they would see that. It shows up on a dashboard for them with a flag, and sort of with an action flag, and yeah.
Awesome. What are some of the metrics that you track in terms of reducing costs and improving quality?
Yeah. So, obviously we want to hit everything in the quintuple aim, and I think we are. All the aims. And I think, and we are. Early data shows that, and we're continuing to collect data in all those regards. The biggest impact we've had that's been most meaningful to our customers, surprisingly, we're fixated on reducing costs and improving outcomes, but our satisfaction, that's been because, the next measure I need to add, anybody who listens to this video who has a good measure for this, the one thing we'd like to add is a measure of trust.
Interesting.
Right? Because that's what we're really building, is trust and engagement. And people
talked to a founder just a few weeks ago who was working on that idea.
Oh,
yeah.
Really?
So I may have to make a connection.
I would love that.
But
I would love that.
So trust as a metric.
Yeah,
it's tricky.
Yes, trust as a metric, which is so, look, we're determined to transform care. That's what we're all about. But for us, it's about hitting kind of those core fundamental shortcomings of our care system, particularly when you think of complex, high risk, high need, vulnerable populations, and it's lack of connection, it's care fragmentation, and it's a breakdown of access and trust. So we know we're increasing trust. We'd love to measure that. And we see that as the gateway to address a broad range of issues, which will result in reductions in emergency room visits, reductions in, unnecessary readmissions, and ultimately with my, as a geriatrician, keeping folks out of institutional settings, right? Helping support people in aging in place.
Yeah, really a force multiplier in an age of workforce crisis within this market, correct?
Yeah, exactly. Yeah. Exactly.
You mentioned you were a geriatrician. We didn't really talk about how you got into this.
Right.
What was that path like?
Yeah, well, I mean, it's been, I trained as a family physician.
Okay.
Community health is in my roots. I trained at a federally qualified community health center. Our whole program was focused on the care of underserved populations. And we were really, by our residency program being there, we were reducing teen pregnancy, reducing infant mortality. I mean, it was really a kind of a public health perspective.
Yeah.
Then I got into geriatrics, and it was like, back 2008, they're saying, wow, the first boomer is collecting Social Security. We're going to have 10,000 people turning 65 every day. Meanwhile, we have less than 7,000 geriatricians in the entire United States. So little by little, I built a career as a leader in aging services and innovation in geriatric care. That I've gone on now to leverage that experience and that network to help, to build our vision and build our model. And really our objective is now to do that at scale.
Got it.
And that's where my co-founder, Catherine Steinberg, she comes in because she's a care transformation specialist. Her whole, expertise, network, everything, she blows my mind. I pinch myself that we get to be on this journey together. She's able to help us, really plan out, execute to be able to do this at scale. And then, of course, bringing a third technical co-founder in Charles Johnson, somebody who can help us build the technology the right way, that's solving problems that matter to people in a way that works for them, frictionless for the end user.
Yeah. Last question. You've been in this industry for a while. So much talk about age tech and where we're going. How have you seen the attitudes and change over the last few years in terms of the acceptance of technology, kind of the idea that we need an inflection point right now and we need change?
Yeah. Well, I'm really excited. We are at an inflection point. The quality of solutions, we've been talking about it for a long time. There's a term, the silver tsunami. I always take issue with that. I call it the great age wave.
Okay.
Tsunamis come without warning, and they're super destructive, devastating, terrible things. This is awesome that we gained 30 years in life expectancy over the last 100 years. We're living longer. It's a great thing. And there's so much power and potential in an aging population. And there's a whole longevity economy.
Yeah.
And so it's really great to see that this is becoming something that people were sort of preaching from the mountaintops is now, it's in the grassroots, it's in the water, and the quality of services and innovation, it's just phenomenal.
Yeah.
We're just seeing, and so we're hoping to just be part of, that leading edge, and then lead a groundswell. We're not worried, surf that great age wave. I'm telling you, because we're not worried about competitors. We're trying to catalyze a movement here. That's why we're health transformers, and that's why we love being part of this startup health ecosystem. Because we've got big problems we're taking on, and so it's all hands on deck is what I always say.
I love it.
And yeah, we're in it.
I love it.
Yeah.
Scott, I love what you're building. I love the heart behind the business, and it's going to be exciting to see where you take it the next couple of years. So thanks for joining me today.
Thank you so much.
All right.
Yeah.
Take care.
Yeah. Can I also mention one other thing while we're here then? Just in terms of all the momentum, updates and whatnot, we got just a lot of cool things going on, but I just wanted to mention this too, because I think it's a great opportunity also for other startups to get involved. The Prime Health Innovation Challenge focused on safety net populations. So we're also a finalist in that. We're going to be doing a pilot demonstration project in Colorado.
Congrats.
And so this is a really cool opportunity, something that I think we could do in Colorado, and then hopefully, continue to spread, very much aligned with our model, working with a rural health system provider that they've been surveying their community. They've been looking at their challenges, and they said, biggest problem, socially isolated, lonely, older people, core issue. And they, like us, see that as sort of this linchpin issue, this kind of the cornerstone thing that you need to address. So we're going to work with them to do it, bring in our whole model, curate that network of community partners. And excitingly, there may be an opportunity for, Colorado Medicaid innovation directors to work with us to look together at the metrics so that we could really look at rolling this out across Medicaid, in Colorado is sort of baked into the program. That would be transformative.
That would be huge
for all of us.
Yeah.
And so Rachel Dixon at Prime Health, really just so appreciative. Really excited to be part of the CHCF cohort on Medicaid innovation. So just really excited in the kind of duals and Medicaid innovation space. So a lot of momentum.
Yeah, what I'm hearing is that there's just a real collaborative spirit behind this right now, that people want to work together and figure out how to plug innovations into populations that they're working on.
Yeah.
There's a desire to raise that tide.
Yeah. Being an entrepreneur is not easy, and there's all sorts of challenges along the way. But when you're in this sweet spot where your challenges are really trying to solve the problems that matter to people in a way that works for them, that's where we want to be. So we'll do anything to just keep, staying on this level and working together with great partners.
I love it.
Yeah.
I love it.
Yeah.
Keep up the great work.
Thank you.
Thanks for joining me today.
Yeah.
And we'll watching how you grow.
Oh, thank you so much.
Right. Thanks, Scott.
Okay.
Our second guest today is Nick Lockett, a co-founder at Pear Suite. As you'll hear, Pear Suite gives organizations the tools necessary to track community-driven care and identify social determinants of health. Their data-driven approach upgrades a life-saving process of outreach to seniors that has often been relegated to pen and paper. Here's the interview with Nick Lockett, which was recorded at the Vive conference in Nashville. Nick, thanks for joining me today.
Thank you. Yeah.
Let's start by just level setting. Give me the pitch. What's Pear Suite?
Awesome. Yeah. So Pear Suite is social care coordination software for community health workers. We manage everything from initially assessing a community and an individual's needs all the way through linking them to various different resources that we think can help. And then we track and follow up, close the loop on those referrals, see how well those interventions actually did, what the people still need, and go from there.
How'd you get into this work?
Yeah. So that's kind of an interesting story. I have always been in tech. I've been passionate about tech and passionate about helping the world, making it a better place, advancing society. My grandparents were actually ranchers out in Missouri, middle of nowhere. Yeah. And so they, unfortunately, they're a very isolated community, and they're 45 minutes to the nearest grocery store, lots of social health issues. Okay. And as they started to age, they weren't able to get the food that they needed. They weren't able to get the care that they needed. And their health kind of declined slowly and then all at once. Okay. There wasn't any infrastructure, any support in place to reach out and give them the help that they needed. So it was unfortunate. Eventually, the family had to step in and move them off of the ranch that they loved so much into, care facilities, nursing homes, things like that.
When did that experience move from like recognition of the problem to maybe like a aha moment that there could be a solution?
Yeah. So when we were like looking into it and figuring it out, we realized that what it was is no one really knew any of these issues. They were isolated. They were living alone. And if they had just been connected to programs that already existed in their community, already existed in the areas around them, then we wouldn't have had to do any of this. Their health wouldn't have been able to decline as how it did, how badly it did. And And if we had just been able to reach out to them where they were, we could have prevented a lot of these issues from happening.
Okay, so let's get back to Pear Suite's platform. What's the experience? Is it something that a community health worker logs into and works on?
Absolutely, yeah. So it works a lot like a CRM. They log in and it guides through the entire process. So we're able to institutionalize and standardize, automate a lot of the services that they're doing so that they're able to provide better care to more people.
Okay. Walk me through it. Let's say I'm a community health worker. Well, back up. What would be a typical partner who's using Pear Suite?
Yeah. So we work with any group that has these community health workers. So we see those in a lot of Medicaid plans have teams like this.
Okay.
We see FQHCs, and then finally community organizations.
How were these patients being managed prior to Pear Suite?
Yeah, so it kind of depends because it's a fragmented.
Yeah, you're talking about a range of types of organizations.
Exactly. Some of them build their own software. Some of them try to hodgepodge together systems that should be used for other things.
Yeah.
There isn't anyone else right now that's building software specifically for these people.
And I'm sure some folks are on Excel or
exactly.
on paper or
a lot of paper.
Go check on so-and-so.
Yeah.
Really.
Exactly.
Okay, so let's say I'm with an organization that works with a managed care organization.
Yeah.
What's my experience? What's sort of the dashboard experience for me?
Yeah. So, like I said, we automate and manage everything. You log in there and you see a list. These are the people that I'm supposed to help. These are backgrounds for them. This is like the assessment that we're supposed to do. I know I followed up with them last week and this is what we figured out. These are resources that we think are a particularly good fit. That's for the individual worker level. From like a higher up perspective, we have population level analytics that say these are the resources that have been working well. These are how many people we're reaching out to, what those conversations are looking like, who needs help with what.
Yeah,
essentially.
Yeah. How do you see Pear Suite fitting into just sort of the cultural moment we're in terms of the aging of the population?
Absolutely.
And really not having the workforce to take care of people?
I mean, that's another reason why I'm so excited about it is this is a growing area. There's a lot of movement in this space.
Yeah.
And so we're hoping that we can be one of the main players that sort of helps to improve both the quality and the quantity of work